And joining us in the studio today to talk a little more about Ebola and the global fight against deadly epidemics is Dr. Peter Tinnemann, an expert for tropical medicine and global health. And he's also worked in Africa for several years, actually fighting the Lassa virus at the time. What do you think about these mobile labs? Are they actually helpful in combating epidemics?
Well, I think it's very respectful that people in Germany start thinking how they could contribute to actually diagnosing diseases that are mostly prevalent in low-income countries, in very remote areas, and that we in Germany, scientists, start thinking what their responsibility could be. But I think it would be nice to not only have a mobile laboratory and take it away again, but I think in those remote areas it is essential that people will have constant access to diagnostics and treatment. So why to make it mobile? Leave it there. Make it accessible to the people so they can use it better.
Leave the equipment there after using it. That's the message. Okay, let's take a look at the current situation in West Africa. Experts are still trying to get Ebola epidemic in West Africa under control. Around 3,000 people have died since it began in December 2013, and around 7,500 are believed to be infected. The mortality rate for some strains of the virus is around 90%, and the first cases of the disease have also appeared in the US and Europe. Now, Dr. Tinnemann, do you have the impression that the measures that have been taken to fight the virus are actually enough and good enough to really be successful?
Well, the last couple of weeks and months have shown that the outbreak is continuously spreading. The numbers are rising, the numbers of patients, the numbers of deaths is rising. Doctors in those countries affected do not have medicines, they have no vaccines to actually treat the patients, which is for a doctor, it breaks your heart if you can't do anything. So I think what really needs to be done now is, on the one hand side, implement very, very strict control measures so that the transmission will be broken. Right? But we also need to look clearly at possibilities to immunize and treat patients.
Actually, pharmaceutical industry has 2 vaccines in trials. Aren't they doing enough?
Well, we haven't seen them yet. They are in trials still. The question is, why don't we have them yet ready available for such diseases? In the last couple of years, we've seen continuously, not continuously, we have seen outbreaks again and again and again of Ebola. Still, and we know that there has not been any medicine available. Still, the pharmaceutical industry not yet has produced anything readily available on the market. And I think that's a failure in the system. We need to actually look at the pharmaceutical industry to tell them what we want medicines for. But also, I think for researchers, it would be important to make sure that if they have ideas, if they have products in the pipeline, to make them available for situations like this.
Well, the representatives of pharmaceutical industry are also taking part in the World Health Summit that is going on in a few weeks here in Berlin. What do you think? Can a meeting like that actually improve the situation?
Well, I personally think it's very important to sit together and discuss and exchange ideas. And I think that's a great opportunity that the World Health Summit offers. I think since the private industry is involved there as well, it is time that scientists and politicians and civil society start telling what we are expecting from them. I think we could have very clear messages coming out there and say, like, you are responsible to give us these drugs because that's what you should be doing. This is what we expect from you.
Let me hear what you actually expect about the Ebola epidemics. Do you think that it will explode to become a pandemic?
Well, I think it is likely that we will see more cases of the disease also in other countries. The chances are there. I think the situation yet in West Africa is not under control, and it needs to be looked at how we can actually achieve that.
Thanks a lot for the talk, Peter Tinnemann.